Hi everybody, this is Larry. An afternoon rambling, one that's been bothering me. I think since I heard it last week. There are rising HIV infections in young women. And this is by a latest study that is being done in collaboration with Wits University. And Minister of Health is saying that they are noticing that there is a peak in HIV infections. And when they follow the data, the medical data, it is said that the comparison between young girls and young boys who have the HIV virus has seen that young girls are the ones that are prone to having a peak in the HIV virus between 18 to 20 years old. And then the other half of the equation is saying that older South Africans, 50 and above, are being seen in the data as having the HIV virus, an infection in their older years, from 50 and above. And it is said that older men are the ones who are prevalent, who are being found to be, in the most cases, of people with the HIV virus around that age and slightly older. They are attributing this to what they call the sugar daddies syndrome, which we know is not new, which is transactional sex. And when people talk transactional, they mean the exchange of something for the other. This means there is an exchange of financial benefit for the younger girls by the older men. So this is what data has found, and this is not new. When I did a story similar to this, I think in 2012, or it could be slightly earlier, the same data was coming out about, it was at that particular point in time, it was 1,000 new infections were being noticed in the medical data, and this was because younger girls were getting these 1,000 new infections, right? And I don't remember if it was 1,000 new infections yearly or in a month period, but I think it was a very drastic thing, like in a month period. And this was a study that was launched by Love Life back then. We all, as South Africans, know that Love Life looks at approaches to deal with information for young people around sexual health practices. The reason why I want to talk about this, and I want to hear what other people think about it, besides being a public health geek, struggling to finish a public health master's, and a journalist who's got an interest in health, public health, and especially public health for people who don't have access to private health, who rely on the public health system, is because we need to talk about rules of engagement, right? I think the conversation that people don't remember or are not having, again, is understanding that society is patriarchally based, right? And this means we are talking about men having more stature or having more influence in our society, right? And when it comes to people's condom negotiation, a lot of young women feel like they cannot negotiate, or they do not negotiate it. One as a tool because they'll be accused of promiscuity by their partners, and number two, because they don't feel confident enough to have the condom conversation. And a lot of other young women find themselves in societies that value women's ability to have children. Therefore, they put themselves at risk by trying to get pregnant to prove their worth in society, and then they expose themselves to infection. Let's have a conversation, a real conversation about the rules of engagement and about people's choice of not using protection. Understanding that PrEP is accessible and available, and also understanding what PrEP is, which is pre-exposure prophylaxis, which is medication that you would take to avoid obtaining the HIV virus, right? But also it does not necessarily prevent you from sexual transmitted infections, right? But a lot of people are emphasizing women's ability to have autonomy of their bodies, right? But we're not having an honest conversation about society, young women, the confidence to negotiate and to condom negotiate, right? I say this because when I was 33, that's when I started, 23, when I started working, walking around with my purse, and in my bag, I would have, alongside my pads, I would have my condoms. When that was the time, not anymore. But there always used to be a particular poking thing that used to say, why are you walking around with a condom as a woman? As if there's something taboo about being a woman and walking around with a condom. Number one, it's very unfortunate. We live in a society where many women can get SAID and also get raped, right? One, it's a prevention I don't think is fair for us to be carrying around, but also people or women, and young women, I work with a lot of young people, and having access or having safety measures for sexual activity in your own person as a woman is still something that is taboo. I've seen this as a young woman. I've seen this as a young person new in their career. I've seen this even growing up. The fact that I used to be okay with knowing that I've got in my bag was an assumption that there's promiscuity and there's unsafe sexual practice, and that there's multiple concurrent partners at the same time. But when we know revenge diaries, when men are cheating with 1, 2, 3, 5, 11 people at the same time and can expose other people to sex and sexually, can expose other people to sexually transmitted infections, and obviously sometimes in the advent to HIV, the virus, that is not being spoken about. And also women also get used as proxy testers when their partners find out that they are HIV positive. 1 in 3 women, so a third of women who are pregnant, find out that they've got the HIV virus. And this is according to data, not me. According to data, find out that they are HIV positive when they actually go for testing and prenatal care. So what is the rule of engagement that we are teaching young women, that we are helping them understand that the autonomy of their body is an actual everyday exercise? There's a lot of things I've spoken about here. Just the health junkie in me. But I'm really, really concerned over people think women have got autonomy and they show having autonomy, but in the actual moments of negotiating with a partner that is in front of you to use protection, young women don't feel the confidence to do that. Where are we doing our part?